Welcome back to Midday Kentucky, everyone. Well, Dr. John Mullins is in the house, and he, of course, is from Marshall Lifestyle Medicine. Welcome back to my show.
Thank you.
Our show, I should say.
Thank you
What
both
was
for
I
having
just
me,
saying?
gentlemen.
Absolutely. No, it's my show now. I'm sitting in the middle. That's right.
Exactly.
It's okay.
All right. Last time you were in, we were talking about men's health
Yes.
and men's hormone levels.
Yes.
Now, let's start off. We're talking about female hormones and their lifestyle as well. What is anti-aging medicine to begin with?
Well, the basic premise of anti-aging medicine is instead of trying to wait until folks get sick, it's meant to allow people to gracefully grow older without the sequela necessarily that's been associated with the aging process. So it's okay to look and feel and perform your best as you age into your 60s, 70s, and well beyond, gracefully, as opposed to conventional medicine in the way that it just reacts when people are sick, and here's a pill and here's a test. This is meant to prevent that and to maximize people's lifestyle all the way through that aging process.
Do you feel like you're spending a lot of your time counteracting bad diet and lack of exercise on people sometimes? Is you're like they come to you because they didn't recognize how important that was for maybe 20 years prior, 30s and 40s?
Absolutely, and that's the reason our clinic is called Lifestyle Medicine, because at the core of it is lifestyle-related choices, and of the core of that is fitness and nutrition. And the low-hanging fruit outside of that is their hormone levels, which decline dramatically as you get older, and so we try to balance those out.
For some people.
For some people, exactly.
Not for me.
Not everyone. Not everyone.
Okay, well, let's just jump right into it. Three guys talking about female hormones.
Yeah, right.
Women's health and issues.
This makes total sense. It's like a congressional committee on
Tell us a little
women's
bit
health.
about hormone therapy
Gentlemen.
in women.
Well, hormone therapy in women, you know, it's been a little bit more publicized on the men's side as to what exactly low testosterone means, but for a woman who gets into her late 30s and beyond, the symptoms associated with her declines in her estrogen, progesterone, testosterone, growth hormone are a little more subtle and a little bit more profound. They start gaining weight, they lose confidence, they have less sexual desire, and it really affects their overall confidence level, and they start substituting some of those confidence things by doing aesthetic treatments, which we provide at our place, but we're convinced that beauty starts from the inside out. So we focus on the inside, and then I think we're going to flash some pictures up here in a minute ago with some of the stuff that you can see visually, but beauty actually starts from the inside. And these women, when you get them feeling the way they were when they're in their younger years, they start feeling naturally more comfortable and naturally more confident, and then the other stuff is just the icing on the cake.
Well, what are we looking at up on the screen
Well,
here?
we're looking at some aesthetic treatments that were performed in our clinic, and they're noticeable and they're very profound. The way that we approach aesthetic medicine these days is it's minimally invasive, and there's been recent studies that show that there's a very large pool of women and men that want to have aesthetic treatments, but they're fearful of a couple things. One, they think it's going to hurt, and hurt profoundly. And two, they think it's not going to be natural in appearance when it's actually performed, and that's true in some clinics. So we try to focus on a pain-minimized approach and a natural finish. And that is really what we're after in our clinic. And so the images that we're showing, although profound, are not meant to be over the top. You don't want people. You really don't want people to know you've had really much done. You just want to look like a better version of yourself, a well-rested.
You don't want to look like your face was removed and stapled back on, and some version of sort of a wet duck.
Yes,
exactly. I've always said that like the early facelifts and stuff that was done for a long time, it was you were like seeing test subjects, not actual people, and so they walk around and they all have the same. They look like the same human being. Like
you leave B. Arthur alone.
No, I think this look is very attractive. The sort of duck lips, super cheekbone monster that lives in the basement. You just chuck meat down the stairs and go like, yeah, that's what I want to look like.
And women and men don't want to look like that.
No,
they don't want to look like cartoon characters. I mean,
right.
there's a few that do, but we really are focused on a natural appearing. Look like you had a really good night's sleep on a nice vacation.
A rested day.
A rested day, exactly, and that's what we're trying to do.
You're looking at some more before and afters here as well. The one thing that I do like about seeing some of these, John, is that you do them quite naturally as well.
Absolutely.
People can come into your clinic, have a consultation, even if they're unsure of what they want done, they can at least have that consultation and ask you your professional advice.
And we try to give them advice, and we really try to make it a comprehensive program where we're focusing on their body, their soul, their lifestyle, and their outward appearance. And that's really what differentiates ourselves from other clinics that are trying to focus on one or the other of those categories.
Would you do that?
Of course. At some point. I have no
well,
problem.
lots of men do it.
Thank you.
I think,
more men should do it.
Yeah, I think to some level balancing your hormones especially will often that's the tipping point for people to get their confidence back to start working out
Absolutely.
again. It makes the difference. I do intermittent fasting. I only eat during an 8-hour window during the day because that helps both your hormone levels and your fat loss. It's perfect for all that stuff. So yeah, of course.
Okay, good. Well, Dr. John, thank you so much.
It's
for
always a
coming.
pleasure.
We're going to see
Yeah.
you again
Absolutely.
next week.
I'll see you
If
next
you
week.
want to find out more information.
And you
about
look
attitude.
fantastic. I just wanna-
WTVQ. He's 105.
That's right. Yeah, absolutely.
We'll be right back after this short break. Completely lost where I'm at.
Thanks.
Stick around.
That's right.